Hello, nursing students. Welcome to Nursing Exam Preparation, your ultimate resource for excelling in nursing exams with confidence. In today's video, we'll guide you through 120 multiple-choice questions and CQs on medical surgical nursing. Each question is thoughtfully designed to test your knowledge and deepen your understanding of this vital area of nursing practice. After every question, you'll find detailed explanations to help you grasp the correct answers and the rationale behind them. Whether you're beginning your studies or gearing up for exams, this video is packed with content to sharpen your skills, enhance your critical thinking, and solidify your grasp of medical surgical nursing concepts. Don't forget to like, share, and subscribe to Nursing Exam Preparation for more valuable resources. Tap the bell icon to stay notified about our latest videos, all tailored to support your success. Once you've completed the video, share your score in the comments below. We'd love to know how you did. Let's dive in and work towards mastering medical surgical nursing and achieving exam success. 1. Which of the following is the most common complication following a laparoscopic cholecystectomy? A. Bile leak. B. Postoperative pneumonia. C. Infection at the incision site. D. Deep vein thrombosis, DVT. Answer: A. Bile leak. Rationale: a bile leak is a known complication after laparoscopic cholecystectomy, occurring when the bile duct is inadvertently injured during the procedure. Pneumonia, infection, and DVT are potential complications but are not as specific or common to this type of surgery. 2. What is the primary purpose of administering preoperative antibiotics to a patient undergoing surgery? A. To prevent postoperative infections. B. To reduce the risk of intraoperative bleeding. C. To control pain during the procedure. D. To improve tissue oxygenation. Answer: A. To prevent postoperative infections. Rationale: preoperative antibiotics are administered to prevent infections at the surgical site, especially in procedures involving implants, contamination risk, or where infection could lead to serious complications. Reducing bleeding, pain, and improving oxygenation are managed by other means. 3. A patient is receiving morphine for pain management following abdominal surgery. Which of the following is a priority nursing intervention? A. Monitor for constipation. B. Assess for respiratory depression. C. Monitor for signs of infection. D. Assess for fluid imbalance. Answer: B. Assess for respiratory depression. Rationale: opioid analgesics like morphine can cause respiratory depression, which is the most serious side effect that needs to be monitored closely. While constipation and infection are concerns, respiratory depression poses a more immediate life-threatening risk. 4. After mastectomy, which of the following positions should the nurse encourage the patient to use to promote drainage of lymph fluid from the affected arm? A. Prone with both arms at the side. B. Semi-Fowlers with the affected arm elevated. C. Supine with arms across the chest. D. Side-lying with the affected arm extended. Answer: B. Semi-Fowlers with the affected arm elevated. Rationale: elevating the affected arm after a mastectomy promotes lymphatic drainage and reduces the risk of lymphedema. The semi-Fowlers position also helps reduce the risk of respiratory complications. Prone, supine, and side-lying positions do not adequately promote lymphatic drainage. 5. Which medication is used to reverse the effects of heparin in the event of an overdose? A. Vitamin K. B. Protamine sulfate. C. Folic acid. D. Calcium gluconate. Answer: B. Protamine sulfate. Rationale: protamine sulfate is the antidote for heparin overdose, as it neutralizes heparin's anticoagulant effect. Vitamin K is used for warfarin reversal, not heparin. Folic acid is used in the treatment of certain types of anemia, and calcium gluconate is used to treat hypocalcemia. 6. What is the primary goal of care for a patient undergoing coronary artery bypass graft (CABG) surgery in the immediate postoperative period? A. To prevent graft failure. B. To reduce the risk of infection. C. To manage pain effectively. D. To promote early mobilization. Answer: A. To prevent graft failure. Rationale: the primary goal after CABG is to ensure that the grafts remain patent, as graft failure can lead to ischemia or heart attack. While infection prevention, pain management, and early mobilization are important. They are secondary to ensuring graft success. 7. What is a major nursing consideration when caring for a patient who has undergone a craniotomy? A. Monitoring for signs of infection at the incision site. B. Keeping the patient in a side-lying position to prevent aspiration. C. Monitoring for signs of increased intracranial pressure, ICP. D. Encouraging deep breathing and coughing exercises. Answer. C. Monitoring for signs of increased intracranial pressure, ICP. Rationale. After a craniotomy, monitoring for ICP is the priority to avoid brain herniation or damage. Although infection monitoring is important, increased ICP is a more immediate concern. Side-lying is not recommended for patients with cranial surgery, and deep breathing exercises should be performed cautiously to avoid ICP increases. 8. Which of the following is a priority assessment for a postoperative patient recovering from general anesthesia? A. Neurological status. B. Oxygen saturation level. C. Wound integrity. D. Bowel sounds. Answer. B. Oxygen saturation level. Rationale. Oxygen saturation level is the priority assessment immediately after general anesthesia to ensure adequate oxygenation and prevent hypoxia. Neurological status, wound integrity, and bowel sounds are important, but secondary assessments following the restoration of airway function and oxygenation. 9. What is the most common cause of wound dehiscence following abdominal surgery? A. Infection. B. Excessive tension on the incision. C. Poor nutritional status. D. Use of corticosteroids. Answer. B. Excessive tension on the incision. Rationale. Wound dehiscence most commonly occurs when there is excessive tension on the incision, particularly in the abdominal area, leading to the separation of wound edges. Infection, poor nutrition, and corticosteroid use can also contribute, but tension on the incision is the most direct cause. 10. Which of the following is the best nursing intervention for preventing venous thromboembolism, VT, in a postoperative patient? A. Administering anticoagulants as prescribed. B. Encouraging early ambulation. C. Applying an abdominal binder. D. Encouraging high-protein, low-carb diet. Answer. B. Encouraging early ambulation. Rationale. Early ambulation is one of the most effective methods to prevent VTE in postoperative patients. While anticoagulants may be prescribed, they are not a substitute for physical activity. Abdominal binders and diet recommendations are not primary interventions for VTE prevention. 11. A nurse is caring for a postoperative patient who is receiving intravenous fluids. Which of the following is the most important nursing intervention to prevent fluid overload? A. Monitor the patient's intake and output. B. Administer diuretics as prescribed. C. Increase the infusion rate of fluids. D. Monitor the patient's blood pressure. Answer. A. Monitor the patient's intake and output. Rationale. Monitoring intake and output is crucial for detecting fluid overload, as it provides direct information about the patient's fluid balance. Administering diuretics and increasing the infusion rate are interventions based on specific orders, not general nursing practice. Blood pressure monitoring is also important, but does not provide as direct a measure of fluid balance. 12. A patient undergoing a hip replacement is at risk for deep vein thrombosis, DVT. Which of the following interventions should the nurse prioritize? A. Administer heparin as prescribed. B. Apply a compression stocking to both legs. C. Encourage early ambulation. D. Administer pain medication as prescribed. Answer. C. Encourage early ambulation. Rationale. Early ambulation is the most effective intervention to prevent DVT in postoperative patients by promoting circulation. While heparin, compression stockings, and pain medications are also part of the plan, they are secondary to mobilizing the patient. 13. Which of the following is the primary concern when caring for a patient in the immediate postoperative period following a thyroidectomy? A. Risk for respiratory distress. B. Risk for hemorrhage. C. Risk for infection. D. Risk for nerve damage. Answer. A. Risk for respiratory distress. Rationale. The primary concern after thyroidectomy is the risk of respiratory distress due to swelling or bleeding around the airway. While hemorrhage, infection, and nerve damage are also concerns, respiratory distress should be monitored first. 14. The nurse is preparing a patient for discharge following a laparoscopic appendectomy. Which of the following discharge instructions is most important? A. Avoid driving for at least 2 weeks. B. Consume a high-fiber diet to prevent constipation. C. Report any redness, warmth, or drainage at the incision site. D. Resume normal activity immediately. Answer: C. Report any redness, warmth, or drainage at the incision site. Rationale: infection is a common complication after any surgical procedure. Patients must be instructed to report signs of infection like redness, warmth, or drainage at the incision site. While avoiding driving and consuming a high-fiber diet are important, recognizing infection is the priority. 15. Which of the following is the most important nursing action for a patient recovering from general anesthesia? A. Assess for signs of postoperative delirium. B. Monitor the patient's airway and breathing. C. Provide pain management. D. Encourage fluid intake. Answer: B. Monitor the patient's airway and breathing. Rationale: after general anesthesia, ensuring the patient's airway is patent and that they are breathing adequately is the highest priority. Pain management, fluid intake, and delirium prevention are important but secondary concerns. 16. A patient is scheduled for a gastrectomy. Which of the following postoperative complications should the nurse monitor for? A. Hyperkalemia. B. Paralytic ileus. C. Pulmonary embolism. D. Hypertension. Answer: B. Paralytic ileus. Rationale: a paralytic ileus, a temporary cessation of bowel activity, is a common complication following abdominal surgery, especially gastrectomies. Hyperkalemia, pulmonary embolism, and hypertension are less common in this setting but still possible. 17. When administering opioids to a postoperative patient, which of the following is a priority nursing action? A. Administer the medication on a fixed schedule. B. Assess for signs of respiratory depression. C. Offer a non-opioid pain management option. D. Monitor the patient's bowel movements. Answer: B. Assess for signs of respiratory depression. Rationale: opioids can cause respiratory depression, which is a life-threatening side effect. Assessing respiratory rate and depth is the most important intervention. While offering non-opioid options, administering on a fixed schedule and monitoring bowel movements are also important. They are secondary to ensuring safe respiratory function. 18. A nurse is caring for a patient following a colon resection. Which of the following should be monitored closely in the first 24 hours postoperatively? A. Fluid and electrolyte balance. B. Bowel sounds. C. Incision site for signs of infection. D. Pain levels. Answer: A. Fluid and electrolyte balance. Rationale: following a colon resection, fluid and electrolyte balance is critical to ensure the patient's body can compensate for losses from the surgery and prevent complications such as hypovolemia or electrolyte imbalance. Bowel sounds, infection, and pain are also important but secondary in the immediate postoperative period. 19. A patient is diagnosed with postoperative pneumonia. Which of the following interventions is most effective in preventing further complications? A. Administering antibiotics as prescribed. B. Encouraging the patient to cough and deep breathe. C. Increasing the patient's oxygen supplementation. D. Administering antipyretics to lower the fever. Answer: B. Encouraging the patient to cough and deep breathe. Rationale: the most effective way to prevent complications from pneumonia is to mobilize secretions through coughing and deep breathing. While antibiotics, oxygen, and antipyretics are important, they address symptoms rather than preventing pneumonia-related complications. 20. A nurse is caring for a patient after a hip replacement surgery. Which of the following is an important consideration when repositioning the patient? A. Keeping the affected hip in adduction. B. Placing a pillow between the patient's knees. C. Using a foam cushion for comfort. D. Keeping the patient in a supine position at all times. Answer: B. Placing a pillow between the patient's knees. Rationale: after hip replacement surgery, placing a pillow between the knees helps prevent dislocation of the hip joint by keeping the hip in abduction. Keeping the hip in adduction, using a foam cushion, and maintaining a supine position are not recommended for optimal healing. 21. A postoperative patient has a urinary catheter in place. Which of the following should be monitored closely to prevent complications? A. Amount of urine output. B. Pain at the insertion site. C. Temperature every 2 hours. D. Blood pressure every 4 hours. Answer: A. Amount of urine output. Rationale: monitoring urine output is essential for detecting early signs of urinary retention or infection. While pain, temperature, and blood pressure are important, they do not directly relate to complications from the urinary catheter as much as urine output does. 22. A patient undergoing a cesarean section is at risk for hemorrhage. Which of the following is the nurse's priority intervention? A. Massaging the uterus to promote contraction. B. Encouraging the patient to rest and avoid movement. C. Administering oxytocin as prescribed. D. Monitoring the patient's blood pressure frequently. Answer: A. Massaging the uterus to promote contraction. Rationale: after a cesarean section, massaging the uterus helps to promote uterine contraction and prevent hemorrhage. While oxytocin and blood pressure monitoring are important, the priority intervention is to help the uterus contract and control bleeding. 23. A postoperative patient is complaining of pain at the incision site. Which of the following is the most appropriate first action? A. Administer pain medication as prescribed. B. Assess the incision site for signs of infection. C. Ask the patient to rate their pain on a scale of 0 to 10. D. Apply a heating pad to the area. Answer: B. Assess the incision site for signs of infection. Rationale: the most appropriate first action is to assess the incision site for signs of infection, such as redness, swelling, or drainage. This will help determine if the pain is due to an infection that may require different management. Administering pain medication, asking the patient to rate their pain, and applying a heating pad are secondary to the initial assessment for infection. 24. A nurse is providing discharge teaching to a patient following a hip replacement. Which of the following instructions should be included? A. You should avoid bending your hip past a 90-degree angle. B. You can resume driving once you feel comfortable. C. You may sleep on your affected side after 2 weeks. D. You can resume normal activity in 1 week. Answer: A. You should avoid bending your hip past a 90-degree angle. Rationale: after hip replacement surgery, it is critical to avoid bending the hip past a 90-degree angle to prevent dislocation of the new joint. The other options, such as resuming driving, sleeping on the affected side, or resuming normal activities too soon, are not recommended and can delay healing or cause complications. 25. A nurse is caring for a postoperative patient who has developed a fever. Which of the following is the first step in assessing the cause? A. Perform a physical assessment. B. Obtain a blood culture. C. Administer antipyretics. D. Assess the surgical site for signs of infection. Answer: D. Assess the surgical site for signs of infection. Rationale: the first step in assessing the cause of a fever in a postoperative patient is to check the surgical site for signs of infection, such as redness, swelling, warmth, or drainage. This helps to determine if the fever is related to a local infection. While a physical assessment, blood culture, and antipyretics are important, assessing the surgical site should be done first to identify the underlying cause of the fever. 26. A patient is scheduled for an elective abdominal surgery. Which of the following assessments is most important prior to the procedure? A. Bowel sounds. B. Vital signs. C. Level of pain. D. Skin integrity. Answer: B. Vital signs. Rationale: vital signs are the most important preoperative assessment to evaluate the patient's stability for surgery. Abnormal vital signs, particularly blood pressure, heart rate, and oxygen saturation, can indicate a need for intervention before surgery. Bowel sounds, pain level, and skin integrity are important but secondary to evaluating vital signs. 27. Which of the following is the priority nursing action for a patient with a suspected pulmonary embolism following surgery? A. Administer anticoagulants as prescribed. B. Elevate the patient's legs. C. Administer oxygen therapy. D. Encourage coughing and deep breathing. Answer: C. Administer oxygen therapy. Rationale: oxygen therapy is the priority intervention for a suspected pulmonary embolism to ensure adequate oxygenation. While anticoagulants, leg elevation, and deep breathing are important, oxygen therapy directly addresses the hypoxia associated with pulmonary embolism. 28. A postoperative patient has a nasogastric (NG) tube in place. Which of the following is the most important nursing action for the nurse to perform? A. Monitor the tube for patency. B. Provide frequent oral care. C. Check for bowel sounds. D. Ensure the patient is on a high-protein diet. Answer: A. Monitor the tube for patency. Rationale: it is essential to monitor the NG tube for patency to prevent complications like aspiration, nausea, and vomiting. Oral care is important but secondary to ensuring that the tube is functioning properly. Bowel sounds and diet are not immediate concerns when the focus should be on tube function. 29. A patient is scheduled to receive a blood transfusion. Which of the following actions should the nurse take first? A. Verify the patient's identity. B. Check the patient's vital signs. C. Obtain a consent form for the transfusion. D. Verify the blood type and cross-match. Answer: D. Verify the blood type and cross-match. Rationale: verifying the blood type and cross-match is the most critical step before initiating a blood transfusion to prevent transfusion reactions. While obtaining consent, checking vital signs, and verifying the patient's identity are important, blood compatibility must be confirmed first. 30. A postoperative patient is complaining of pain at the incision site. Which of the following is the most appropriate first action? A. Administer pain medication as prescribed. B. Assess the incision site for signs of infection. C. Ask the patient to rate their pain on a scale of 0 to 10. D. Apply a heating pad to the area. Answer: B. Assess the incision site for signs of infection. Rationale: before administering pain medication, the nurse should assess the incision site for any signs of infection, such as redness, swelling, or drainage. This assessment helps determine if the pain is related to an infection that may require different management. Rating pain and applying a heating pad are secondary actions. 31. After a laminectomy, which of the following actions should the nurse take to reduce the risk of postoperative complications? A. Encourage early ambulation. B. Apply sequential compression devices, SCDs. C. Position the patient on their side to reduce pressure. D. Encourage deep breathing and coughing exercises. Answer: B. Apply sequential compression devices, SCDs. Rationale: sequential compression devices, SCDs, are used postoperatively to reduce the risk of deep vein thrombosis, DVT, a common complication after spine surgery. While early ambulation, positioning, and deep breathing exercises are important, SCDs are specifically effective in preventing DVT. 32. A postoperative patient is at risk for wound infection. Which of the following interventions should the nurse prioritize? A. Administer prescribed antibiotics. B. Provide proper wound care. C. Monitor the patient's vital signs. D. Encourage the patient to eat a high-protein diet. Answer: B. Provide proper wound care. Rationale: proper wound care is the most important intervention to prevent infection, as it helps keep the surgical site clean and reduces the risk of contamination. While antibiotics, vital sign monitoring, and a high-protein diet are important, wound care is the priority. 33. A postoperative patient is at risk for urinary retention. Which of the following is the priority nursing action? A. Encourage the patient to drink fluids. B. Monitor the patient for bladder distension. C. Assess for signs of infection. D. Insert an indwelling catheter. Answer: B. Monitor the patient for bladder distension. Rationale: monitoring for bladder distension is the priority to detect urinary retention early. If the patient is unable to void, bladder distension can lead to discomfort and complications. Encouraging fluids, assessing for infection, and inserting a catheter are subsequent actions based on assessment findings. 34. A nurse is caring for a patient following a thyroidectomy. Which of the following complications is most likely to occur? A. Hypocalcemia. B. Hyperkalemia. C. Hypoglycemia. D. Hypertension. Answer: A. Hypocalcemia. Rationale: hypocalcemia is a common complication following thyroidectomy due to potential damage to the parathyroid glands, which regulate calcium levels. Hyperkalemia, hypoglycemia, and hypertension are not typically associated with thyroidectomy. 35. A nurse is providing discharge teaching to a patient following a hip replacement. Which of the following instructions should be included? A. You should avoid bending your hip past a 90-degree angle. B. You can resume driving once you feel comfortable. C. You may sleep on your affected side after 2 weeks. D. You can resume normal activity in 1 week. Answer: A. You should avoid bending your hip past a 90-degree angle. Rationale: after hip replacement surgery, patients should avoid bending the hip past a 90-degree angle to reduce the risk of hip dislocation. Resuming driving, sleeping on the affected side, and normal activities are typically not allowed immediately after surgery and depend on the surgeon's instructions. 36. A postoperative patient is experiencing nausea and vomiting. Which of the following is the nurse's first action? A. Administer antiemetic medication. B. Encourage the patient to drink clear fluids. C. Assess the patient's bowel sounds. D. Notify the healthcare provider. Answer: A. Administer antiemetic medication. Rationale: the first action is to address the nausea and vomiting by administering an antiemetic medication as prescribed. Afterward, the nurse can assess bowel sounds, encourage fluids, and notify the healthcare provider if the symptoms persist. 37. A nurse is caring for a patient postoperatively who is at risk for aspiration pneumonia. Which of the following interventions should be prioritized? A. Elevate the head of the bed. B. Administer antibiotics as prescribed. C. Encourage deep breathing exercises. D. Encourage the patient to eat a high-protein diet. Answer: A. Elevate the head of the bed. Rationale: elevating the head of the bed reduces the risk of aspiration by promoting the proper positioning of the patient during eating or while unconscious. Antibiotics, deep breathing exercises, and a high-protein diet are important but secondary to positioning to prevent aspiration pneumonia. 38. A nurse is caring for a patient who has undergone a mastectomy. Which of the following should the nurse emphasize in the postoperative teaching? A. Elevate the affected arm to reduce the risk of lymphedema. B. Avoid eating spicy foods to reduce the risk of infection. C. Rest in a supine position to reduce shoulder strain. D. Apply a heating pad to the surgical site to reduce swelling. Answer: A. Elevate the affected arm to reduce the risk of lymphedema. Rationale: elevating the affected arm after a mastectomy helps to reduce the risk of lymphedema by promoting lymphatic drainage. Avoiding spicy foods, resting in a supine position, and using a heating pad are not recommended for postoperative care following a mastectomy. 39. A postoperative patient is experiencing a sudden drop in blood pressure and tachycardia. What is the nurse's first action? A. Administer prescribed intravenous fluids. B. Assess the surgical site for bleeding. C. Notify the healthcare provider. D. Elevate the patient's legs. Answer: B. Assess the surgical site for bleeding. Rationale: a sudden drop in blood pressure and tachycardia may indicate hemorrhage. The first action should be to assess the surgical site for active bleeding. Administering fluids, notifying the healthcare provider, and elevating the legs are appropriate steps, but secondary to assessing for bleeding. 40. A nurse is caring for a postoperative patient who is at risk for deep vein thrombosis, DVT. Which of the following interventions should be prioritized? A. Apply compression stockings. B. Encourage the patient to perform leg exercises. C. Administer prescribed anticoagulants. D. Ensure the patient is hydrated. Answer: A. Apply compression stockings. Rationale: compression stockings are an important intervention to prevent deep vein thrombosis, DVT, by promoting circulation and preventing blood stasis. While leg exercises, anticoagulants, and hydration are also important, compression stockings are the most effective and immediate intervention for DVT prevention in the postoperative period. 41. A postoperative patient is at risk for aspiration pneumonia. Which of the following interventions should the nurse prioritize? A. Elevate the head of the bed. B. Encourage deep breathing exercises. C. Administer antibiotics as prescribed. D. Provide oral hygiene regularly. Answer: A. Elevate the head of the bed. Rationale: the most effective intervention to reduce the risk of aspiration pneumonia is elevating the head of the bed. This helps prevent aspiration of gastric contents and improves airway clearance. While deep breathing, antibiotics, and oral hygiene are important, positioning the patient is the priority intervention to prevent aspiration. 42. A postoperative patient is at risk for wound dehiscence. Which of the following actions is most important to prevent this complication? A. Apply a sterile dressing to the incision site. B. Instruct the patient to avoid coughing. C. Keep the patient NPO for 24 hours. D. Administer prophylactic antibiotics. Answer: B. Instruct the patient to avoid coughing. Rationale: coughing increases intra-abdominal pressure, which can contribute to wound dehiscence. Instructing the patient to avoid coughing is the most important intervention to prevent this complication. Applying a sterile dressing, keeping the patient NPO, and administering antibiotics are all important, but they do not directly address the risk of wound dehiscence. 43. A postoperative patient who had a laparotomy is at risk for paralytic ileus. Which of the following interventions should the nurse implement first? A. Administer prescribed analgesics. B. Encourage the patient to ambulate. C. Monitor the patient's bowel sounds. D. Insert an NG tube to decompress the stomach. Answer: C. Monitor the patient's bowel sounds. Rationale: the first action to assess for paralytic ileus is to monitor bowel sounds, as absence of bowel sounds is indicative of ileus. While analgesics, ambulation, and NG tube insertion may be necessary, the first step is to assess bowel function. 44. A nurse is caring for a postoperative patient who is experiencing chest pain and shortness of breath. What should the nurse do first? A. Administer oxygen. B. Administer morphine. C. Perform a 12-lead electrocardiogram, ECG. D. Notify the healthcare provider. Answer: A. Administer oxygen. Rationale: administering oxygen is the priority action for a patient with chest pain and shortness of breath, as it helps improve oxygenation and can prevent further complications. Administering morphine, performing an ECG, and notifying the healthcare provider are important next steps, but oxygen should be administered immediately. 45. A postoperative patient is at risk for hypovolemic shock. Which of the following assessments should the nurse prioritize? A. Assess the patient's level of consciousness. B. Check the patient's heart rate and blood pressure. C. Monitor urine output. D. Perform a focused neurological assessment. Answer: B. Check the patient's heart rate and blood pressure. Rationale: the priority assessment for hypovolemic shock is evaluating the heart rate and blood pressure, as changes in these parameters can indicate significant fluid loss. Assessing consciousness, urine output, and neurological status are important but secondary to vital sign monitoring. 46. A patient who had abdominal surgery is experiencing nausea and vomiting. What is the nurse's first action? A. Administer antiemetic medication. B. Assess the patient's bowel sounds. C. Administer intravenous fluids. D. Notify the healthcare provider. Answer: B. Assess the patient's bowel sounds. Rationale: the first step is to assess the patient's bowel sounds to determine if the nausea and vomiting are related to a gastrointestinal issue like ileus or obstruction. Administering antiemetics, fluids, and notifying the healthcare provider are appropriate steps but secondary to the assessment. 47. A postoperative patient is complaining of pain at the incision site. What is the priority nursing intervention? A. Administer prescribed pain medication. B. Assess the incision site for signs of infection. C. Teach the patient relaxation techniques. D. Reposition the patient for comfort. Answer: B. Assess the incision site for signs of infection. Rationale: the first priority is to assess the incision site for signs of infection, e.g., redness, swelling, or drainage, as pain could be related to infection. Administering pain medication, teaching relaxation techniques, and repositioning the patient are secondary interventions after assessing for infection. 48. A nurse is caring for a patient who has developed a pressure ulcer post-surgery. Which of the following is the best intervention to prevent further breakdown? A. Reposition the patient every 2 hours. B. Increase the patient's protein intake. C. Apply a moisture barrier cream to the area. D. Use an air mattress to relieve pressure. Answer: D. Use an air mattress to relieve pressure. Rationale: an air mattress is the best intervention to relieve pressure on the skin, which is key to preventing further breakdown. Repositioning, increasing protein intake, and applying moisture barrier creams are also helpful, but the air mattress directly addresses the risk of pressure ulcer formation. 49. A nurse is caring for a postoperative patient who has a urinary catheter in place. Which of the following is most important for the nurse to assess? A. The color and consistency of urine. B. The patient's fluid intake and output. C. The patient's pain level. D. The catheter's patency and position. Answer: D. The catheter's patency and position. Rationale: the nurse should prioritize checking the catheter's patency and position to ensure it is draining properly. While assessing urine color, fluid balance, and pain are important, they are secondary to ensuring that the catheter is functioning as expected. 50. A postoperative patient is having difficulty breathing. Which of the following should the nurse do first? A. Administer oxygen therapy. B. Assess the patient's respiratory rate and oxygen saturation. C. Notify the healthcare provider. D. Encourage coughing and deep breathing exercises. Answer: B. Assess the patient's respiratory rate and oxygen saturation. Rationale: the nurse should first assess the respiratory rate and oxygen saturation to determine the severity of the breathing difficulty. Administering oxygen, notifying the healthcare provider, and encouraging deep breathing exercises are appropriate, but secondary to assessment. 51. A nurse is caring for a postoperative patient who is at risk for DVT. Which of the following interventions is most effective in preventing this complication? A. Administer anticoagulant therapy. B. Apply pneumatic compression devices. C. Encourage the patient to ambulate frequently. D. Increase the patient's fluid intake. Answer: B. Apply pneumatic compression devices. Rationale: pneumatic compression devices, e.g., SCDs, are the most effective in preventing DVT postoperatively by promoting circulation and reducing stasis. Anticoagulants, ambulation, and fluid intake are important, but secondary to using mechanical compression devices for DVT prevention. 52. A postoperative patient is exhibiting signs of infection at the surgical site. Which of the following interventions should the nurse implement first? A. Notify the healthcare provider. B. Apply a sterile dressing to the wound. C. Obtain a wound culture. D. Administer prescribed antibiotics. Answer: B. Apply a sterile dressing to the wound. Rationale: the first intervention is to apply a sterile dressing to the wound to prevent further contamination and manage any drainage. While notifying the healthcare provider, obtaining a culture, and administering antibiotics are important, they follow the application of a sterile dressing. 53. A nurse is caring for a patient post-cardiac surgery who is showing signs of hypovolemic shock. What should be the nurse's first action? A. Administer intravenous fluids. B. Monitor vital signs. C. Elevate the patient's legs. D. Administer prescribed vasopressors. Answer: A. Administer intravenous fluids. Rationale: the first action in managing hypovolemic shock is to administer intravenous fluids to restore circulating volume. Monitoring vital signs, elevating the legs, and administering vasopressors are important, but fluid resuscitation should be prioritized to address hypoperfusion. 54. A postoperative patient who underwent a mastectomy is complaining of pain in the arm on the side of the surgery. Which of the following interventions should be implemented first? A. Instruct the patient to elevate the affected arm. B. Assess the patient for signs of lymphedema. C. Administer prescribed pain medication. D. Apply a cold compress to the area. Answer: B. Assess the patient for signs of lymphedema. Rationale: the first intervention should be to assess the patient for signs of lymphedema, which is a common complication after mastectomy. Elevating the arm, administering pain medication, and applying a cold compress are helpful but secondary to evaluating for lymphedema. 55. A postoperative patient has developed a fever. Which of the following is the priority nursing intervention? A. Administer antipyretics as prescribed. B. Perform a physical assessment. C. Assess the surgical site for signs of infection. D. Notify the healthcare provider. Answer. C. Assess the surgical site for signs of infection. Rationale. The priority action is to assess the surgical site for signs of infection. A fever after surgery is often a result of infection, and early identification of this can guide treatment. Administering antipyretics, performing an assessment, and notifying the healthcare provider are secondary actions. 56. A nurse is caring for a postoperative patient who has been prescribed pain medication. What is the most important action for the nurse to take before administering the medication? A. Assess the patient's pain level. B. Obtain the patient's vital signs. C. Check for any allergies. D. Confirm the patient's identity. Answer. A. Assess the patient's pain level. Rationale. The most important action is to assess the patient's pain level to determine if the prescribed medication is appropriate and effective. While obtaining vital signs, checking for allergies, and confirming identity are important, they are secondary to assessing the patient's pain. 57. A nurse is caring for a postoperative patient at risk for pressure ulcers. Which of the following is the most effective intervention for preventing pressure ulcers? A. Reposition the patient every 2 hours. B. Provide a high-calorie diet. C. Use a foam mattress overlay. D. Apply a moisture barrier to the skin. Answer. A. Reposition the patient every 2 hours. Rationale. The most effective way to prevent pressure ulcers is to regularly reposition the patient, ideally every 2 hours, to relieve pressure on vulnerable areas of the skin. While providing a high-calorie diet, using a foam mattress overlay and applying moisture barriers are beneficial, they are secondary to the priority intervention of repositioning. 58. A postoperative patient develops a hematoma at the surgical site. Which of the following is the priority action? A. Apply pressure to the site. B. Monitor the patient for signs of shock. C. Notify the healthcare provider. D. Elevate the affected area. Answer. A. Apply pressure to the site. Rationale. The priority action when a hematoma develops is to apply pressure to the site to control bleeding. This will help prevent further blood loss and complications. While monitoring for signs of shock, notifying the healthcare provider, and elevating the area are important, they should follow the initial step of controlling the bleeding with pressure. 59. A nurse is caring for a postoperative patient who is at risk for atelectasis. Which of the following interventions should the nurse prioritize? A. Instruct the patient to perform deep breathing exercises. B. Administer prescribed bronchodilators. C. Encourage early ambulation. D. Assess oxygen saturation levels. Answer. A. Instruct the patient to perform deep breathing exercises. Rationale. Deep breathing exercises are the most effective way to prevent atelectasis postoperatively by expanding the lungs and clearing secretions. While administering bronchodilators, encouraging ambulation, and assessing oxygen levels are important, deep breathing exercises should be prioritized to prevent lung collapse. 60. A nurse is caring for a patient who has had a cholecystectomy. The patient is complaining of shoulder pain. What is the most likely cause of this pain? A. Bile leakage from the gallbladder. B. Diaphragmatic irritation from CO2 used during surgery. C. Infection at the surgical site. D. Postoperative blood loss. Answer. B. Diaphragmatic irritation from CO2 used during surgery. Rationale. Shoulder pain is a common complaint after laparoscopic cholecystectomy due to irritation of the diaphragm by carbon dioxide, CO2, used during the procedure. The pain typically resolves within a few days. While bile leakage, infection, and blood loss can cause other symptoms, they are less likely to present as shoulder pain. 61. A postoperative patient is showing signs of fluid overload. Which of the following findings would the nurse expect to assess first? A. Increased blood pressure. B. Decreased urine output. C. Dyspnea and crackles on auscultation. Deep edema in the lower extremities. Answer. C. Dyspnea and crackles on auscultation. Rationale. Dyspnea and crackles in the lungs are early signs of fluid overload and pulmonary edema. These signs typically occur before increases in blood pressure, decreased urine output, and peripheral edema. Monitoring lung sounds is crucial in detecting fluid buildup in the lungs. 62. A nurse is caring for a postoperative patient who is experiencing dizziness and weakness. What should the nurse do first? A. Check the patient's blood pressure. B. Reassure the patient and encourage fluids. C. Assess the patient's airway and oxygen levels. D. Notify the healthcare provider. Answer. A. Check the patient's blood pressure. Rationale. Dizziness and weakness can be signs of hypotension. The first step is to check the patient's blood pressure to assess for low blood pressure. If the patient is hypotensive, additional interventions, such as fluid administration or oxygen, may be required. 63. A nurse is caring for a postoperative patient who is receiving anticoagulant therapy. Which of the following lab values is most important for the nurse to monitor? A. White blood cell count. B. Prothrombin time, PT. C. Serum potassium level. D. Blood glucose level. Answer. B. Prothrombin time, PT. Rationale. Prothrombin time, PT, is crucial to monitor in patients on anticoagulant therapy to ensure that the blood is not too thin or too thick, which could lead to bleeding or clotting complications. The other lab values are important in different contexts, but are not as directly related to anticoagulant therapy. 64. A nurse is caring for a patient who has had a total knee replacement. Which of the following is the most important goal in the immediate postoperative period? A. Prevent infection. B. Achieve adequate pain control. C. Promote early ambulation. D. Maintain adequate fluid balance. Answer. B. Achieve adequate pain control. Rationale. Pain control is the most important goal immediately after knee replacement surgery because it allows the patient to participate in rehabilitation activities, including early ambulation. While preventing infection, promoting ambulation, and maintaining fluid balance are important, they are secondary to pain control. 65. A nurse is caring for a postoperative patient who is at risk for hypothermia. Which of the following interventions should be implemented first? A. Apply a warm blanket. B. Monitor the patient's temperature. C. Increase the room temperature. D. Administer warm fluids. Answer. B. Monitor the patient's temperature. Rationale. The first step is to monitor the patient's temperature to determine the degree of hypothermia. After assessing the temperature, interventions like applying a blanket, increasing room temperature, or administering warm fluids can be implemented based on the findings. 66. A nurse is caring for a postoperative patient who has developed a wound infection. What is the most important action to prevent the spread of infection? A. Apply a sterile dressing to the wound. B. Wash hands before and after patient contact. C. Administer prescribed antibiotics. D. Monitor the wound for changes. Answer. B. Wash hands before and after patient contact. Rationale. Hand hygiene is the most important action to prevent the spread of infection. While applying a sterile dressing, administering antibiotics, and monitoring the wound are important, hand hygiene is the most effective measure to prevent cross-contamination and infection spread. 67. A nurse is caring for a postoperative patient who has a Jackson-Pratt drain in place. Which of the following is the priority nursing action? A. Empty the drain when it becomes full. B. Measure the output from the drain. C. Clean the drain site with antiseptic solution. D. Ensure the drain is secured to the patient's gown. Answer. A. Empty the drain when it becomes full. Rationale. The priority action is to empty the Jackson-Pratt drain when it becomes full to prevent backup and ensure proper drainage. Measuring the output, cleaning the site, and securing the drain are important but secondary to ensuring the drain is functioning properly. 68. A postoperative patient has been placed on a clear liquid diet. Which of the following foods is appropriate for the patient to consume? A. Apple juice. B. Mashed potatoes. C. Chicken broth. D. Scrambled eggs. Answer. A. Apple juice. Rationale. Clear liquids include fluids that are transparent and can be seen through, such as apple juice, broth, and tea. Mashed potatoes and scrambled eggs are not clear liquids and are not appropriate for a clear liquid diet. 69. A nurse is caring for a postoperative patient who is receiving morphine for pain control. Which of the following is the priority assessment before administering morphine? A. Respiratory rate. B. Blood pressure. C. Heart rate. D. Oxygen saturation. Answer: A. Respiratory rate. Rationale: the priority assessment before administering morphine is the respiratory rate, as opioids like morphine can depress the respiratory system. Blood pressure, heart rate, and oxygen saturation are important, but secondary to ensuring the patient can tolerate the medication without respiratory depression. 70. A nurse is caring for a postoperative patient who is experiencing nausea and vomiting. Which of the following is the priority action? A. Administer antiemetic medication. B. Offer clear fluids to the patient. C. Assess the patient's abdominal distension. D. Encourage the patient to take deep breaths. Answer: A. Administer antiemetic medication. Rationale: the priority action for nausea and vomiting is to administer antiemetic medication to relieve symptoms and prevent dehydration. Offering fluids, assessing abdominal distension, and encouraging deep breathing are important, but secondary to addressing the nausea. 71. A nurse is caring for a postoperative patient who has a urinary catheter in place. Which of the following actions should the nurse take to prevent a urinary tract infection (UTI)? A. Secure the catheter to the patient's leg. B. Perform catheter care with soap and water daily. C. Change the catheter every 72 hours. D. Irrigate the catheter as needed. Answer: B. Perform catheter care with soap and water daily. Rationale: routine catheter care with soap and water is essential to prevent infection. While securing the catheter, changing it every 72 hours, and irrigating it may be necessary, the most effective preventive measure is proper catheter care to avoid introducing pathogens. 72. A nurse is caring for a postoperative patient who is at risk for pneumonia. Which of the following interventions should the nurse prioritize? A. Encourage coughing and deep breathing exercises. B. Administer prescribed antibiotics. C. Elevate the head of the bed. D. Provide supplemental oxygen. Answer: A. Encourage coughing and deep breathing exercises. Rationale: coughing and deep breathing exercises help clear secretions and prevent atelectasis, which can lead to pneumonia. Administering antibiotics, elevating the bed, and providing oxygen are important, but secondary to promoting lung expansion and secretion clearance. 73. A postoperative patient is at risk for developing a wound infection. Which of the following interventions is most effective for preventing infection? A. Maintain a sterile technique during dressing changes. B. Apply an antibiotic ointment to the wound. C. Encourage the patient to eat a high-protein diet. D. Administer prescribed immunizations. Answer: A. Maintain a sterile technique during dressing changes. Rationale: maintaining sterile technique during dressing changes is the most effective way to prevent wound infections. This minimizes the risk of introducing pathogens into the surgical site. While applying antibiotic ointment, encouraging a high-protein diet, and administering immunizations may also be beneficial, they are secondary to sterile technique in preventing infection at the wound site. 74. A postoperative patient has a wound that is red, warm, and swollen. What is the most appropriate initial nursing action? A. Apply an ice pack to the wound. B. Notify the healthcare provider immediately. C. Assess for signs of infection. D. Administer pain medication. Answer: C. Assess for signs of infection. Rationale: the first action is to assess the wound for signs of infection, which may include redness, warmth, and swelling. If signs of infection are confirmed, the nurse can notify the healthcare provider, apply ice for inflammation, or administer pain medication. However, assessment should always be the first step to determine the underlying cause. 75. A postoperative patient is experiencing nausea and vomiting after surgery. What is the most appropriate first intervention? A. Offer clear liquids to the patient. B. Administer antiemetic medication. C. Reassure the patient and provide comfort measures. D. Assess the patient's abdominal sounds. Answer: B. Administer antiemetic medication. Rationale: The first intervention for nausea and vomiting is to administer antiemetic medication to help relieve symptoms and prevent further complications, such as dehydration or electrolyte imbalances. While offering clear liquids, providing comfort measures, and assessing abdominal sounds are important, the priority is addressing the nausea directly with medication. 76. A postoperative patient is at risk for developing a venous thromboembolism, VT. Which of the following interventions should the nurse implement first? A. Administer low molecular weight heparin as prescribed. B. Apply compression stockings. C. Encourage early ambulation. D. Monitor for signs of deep vein thrombosis. Answer. C. Encourage early ambulation. Rationale. Early ambulation is the most effective intervention for preventing venous thromboembolism, VT, postoperatively. It promotes circulation and reduces the risk of blood clot formation. While administering heparin, applying stockings, and monitoring for signs of thrombosis are also important, ambulation should be the first action. 77. A nurse is caring for a patient who is post-abdominal surgery and has a nasogastric tube, NGT, in place. The nurse notes that the NG tube is draining a large amount of dark green fluid. What is the nurse's next action? A. Notify the healthcare provider immediately. B. Continue to monitor the drainage. C. Irrigate the NG tube with normal saline. D. Assess the patient's vital signs. Answer. B. Continue to monitor the drainage. Rationale. A large amount of dark green fluid draining from the NG tube is typical after abdominal surgery due to bile secretion. The nurse should continue to monitor the drainage and ensure it does not change to a concerning color or consistency. If the drainage becomes bloody or significantly changes, then further intervention would be necessary. 78. A nurse is caring for a postoperative patient who is receiving epidural anesthesia. Which of the following is the priority nursing intervention? A. Assess for signs of respiratory depression. B. Encourage the patient to ambulate. C. Monitor the patient's heart rate and blood pressure. D. Administer 4 fluids as prescribed. Answer. A. Assess for signs of respiratory depression. Rationale. Epidural anesthesia can cause respiratory depression, which can be life-threatening. Therefore, the priority intervention is to assess for signs of respiratory depression, such as shallow breathing or an oxygen saturation drop. Monitoring vital signs and encouraging ambulation are important, but secondary to addressing respiratory issues. 79. A nurse is caring for a postoperative patient who has a wound drain in place. The nurse notices that the drain has stopped draining. What is the most appropriate action? A. Irrigate the drain with saline. B. Notify the healthcare provider. C. Check for kinks or obstructions in the tubing. D. Replace the drain. Answer. C. Check for kinks or obstructions in the tubing. Rationale. The first action is to check for kinks or obstructions in the drain tubing, which may be causing the lack of drainage. If the tubing is clear, then the nurse may need to notify the healthcare provider. Irrigating or replacing the drain may be necessary later, depending on the cause. 80. A nurse is caring for a patient who is recovering from a total hip replacement. Which of the following should the nurse prioritize to prevent dislocation of the hip? A. Instruct the patient to avoid crossing the legs. B. Teach the patient to flex the hip 90 degrees. C. Encourage the patient to lie on the affected side. D. Allow the patient to bear weight on the affected leg immediately. Answer. A. Instruct the patient to avoid crossing the legs. Rationale. Avoiding crossing the legs is crucial to prevent hip dislocation after a total hip replacement, as flexing or adducting the hip can cause dislocation. The patient should also avoid excessive flexion, 90 degrees, and weight-bearing should be gradually increased under medical guidance, but avoiding leg crossing is the priority. 81. A nurse is caring for a patient who has just undergone a laparoscopic cholecystectomy. Which of the following should the nurse monitor closely for the first 24 hours? A. Urine output. B. Bile leakage from the surgical site. C. Blood pressure. D. Abdominal distension. Answer. D. Abdominal distension. Rationale. After a laparoscopic cholecystectomy, abdominal distension is a common complication due to the gas used to inflate the abdomen during the procedure. The nurse should monitor for signs of distension and ensure the patient passes gas and has bowel movements. While urine output, bile leakage, and blood pressure are also important, abdominal distension takes priority. 82. A nurse is caring for a postoperative patient who is receiving morphine for pain management. Which of the following is the priority assessment before administering the medication? A. Respiratory rate. B. Blood pressure. C. Heart rate. D. Oxygen saturation level. Answer: A. Respiratory rate. Rationale: the priority assessment before administering morphine is the respiratory rate, as morphine and other opioids can cause respiratory depression, which can be life-threatening. Blood pressure, heart rate, and oxygen saturation are also important, but are secondary to assessing for respiratory depression. 83. A nurse is caring for a postoperative patient who has a urinary catheter in place. Which of the following interventions is the most effective in preventing a urinary tract infection, UTI? A. It's perform catheter care daily with soap and water. B. Encourage fluid intake. C. Use sterile technique when inserting the catheter. D. Remove the catheter as soon as possible. Answer: D. Remove the catheter as soon as possible. Rationale: the best way to prevent a urinary tract infection, UTI, in a patient with a urinary catheter is to remove the catheter as soon as possible. Prolonged use of a catheter increases the risk of infection. Performing catheter care and encouraging fluid intake are also important, but are secondary to prompt removal. 84. A postoperative patient has developed a fever on the second day after surgery. What is the most likely cause? A. Infection. B. Inflammatory response. C. Dehydration. D. Blood loss. Answer: B. Inflammatory response. Rationale: a mild fever within the first 48 hours after surgery is often a normal part of the inflammatory response to tissue trauma. If the fever persists or is higher than 101 degrees Fahrenheit 38.3 degrees Celsius, infection should be suspected. Dehydration and blood loss are not typically associated with a fever in the early postoperative period. 85. A nurse is caring for a patient who has undergone a coronary artery bypass graft (CAB) surgery. Which of the following is the most important intervention to prevent postoperative complications? A. Administer pain medication as prescribed. B. Encourage deep breathing and coughing exercises. C. Monitor for signs of bleeding. D. Apply compression stockings. Answer: B. Encourage deep breathing and coughing exercises. Rationale: deep breathing and coughing exercises are essential to prevent atelectasis and pneumonia after surgery, especially in cardiac patients. While pain management, monitoring for bleeding, and applying stockings are important, the priority is ensuring that the patient maintains adequate ventilation and lung function postoperatively. 86. A nurse is caring for a postoperative patient who is receiving oxygen therapy via nasal cannula. The patient's oxygen saturation level is 88%. Which of the following is the most appropriate action? A. Increase the oxygen flow rate. B. Notify the healthcare provider immediately. C. Encourage the patient to deep breathe. D. Reposition the patient. Answer: A. Increase the oxygen flow rate. Rationale: if the oxygen saturation is below 90%, the nurse should first increase the oxygen flow rate as prescribed to improve oxygenation. Repositioning and encouraging deep breathing are also helpful, but should be done after increasing the oxygen flow if saturation remains low. 87. A nurse is caring for a postoperative patient who is receiving heparin for anticoagulation. Which of the following laboratory tests should be monitored closely? A. Prothrombin time, PT. B. Activated partial thromboplastin time, APTT. C. Hemoglobin level. D. Serum calcium level. Answer: B. Activated partial thromboplastin time, APTT. Rationale: the activated partial thromboplastin time, APTT, is used to monitor the therapeutic effects of heparin therapy. Prothrombin time, PT, is monitored for patients on warfarin, while hemoglobin and calcium levels are not directly affected by heparin therapy. 88. A nurse is caring for a postoperative patient who has an incision that is reddened, swollen, and draining purulent material. Which of the following is the priority action? A. Notify the healthcare provider immediately. B. Apply a sterile dressing to the wound. C. Administer antibiotics as prescribed. D. Collect a wound culture. Answer: A. Notify the healthcare provider immediately. Rationale: the priority action is to notify the healthcare provider immediately because the patient may have a wound infection that requires immediate intervention. While applying a sterile dressing, administering antibiotics, and collecting a culture are important, the most critical step is communication with the provider. 89. A nurse is caring for a postoperative patient who is receiving narcotic pain medication. Which of the following is the most important assessment? A. Level of consciousness. B. Bowel sounds. C. Urine output. D. Respiratory rate. Answer: D. Respiratory rate. Rationale: narcotic pain medications can depress respiratory function, making it essential to assess the respiratory rate. The level of consciousness, bowel sounds, and urine output are also important, but respiratory rate is the priority to assess first. 90. A nurse is caring for a patient who has undergone a knee replacement. The patient is experiencing pain and swelling in the surgical leg. Which of the following actions should the nurse take first? A. Elevate the leg. B. Apply ice to the knee. C. Administer pain medication as prescribed. D. Reassess the patient's pain level. Answer: B. Apply ice to the knee. Rationale: applying ice to the knee helps reduce inflammation and swelling postoperatively, which can provide relief from pain. Elevating the leg and administering pain medication are also helpful, but ice is the most effective in reducing swelling initially. 91. A nurse is caring for a patient who has undergone abdominal surgery. The patient reports feeling nauseated. Which of the following is the priority action? A. Administer antiemetic medication as prescribed. B. Reassure the patient and provide comfort. C. Assess the patient's hydration status. D. Encourage the patient to take deep breaths. Answer: A. Administer antiemetic medication as prescribed. Rationale: the priority action is to administer antiemetic medication to alleviate the patient's nausea and prevent complications such as dehydration. Reassuring the patient, assessing hydration, and deep breathing are important but should be secondary to addressing the nausea directly. 92. A postoperative patient is experiencing constipation due to opioid use. What is the most appropriate nursing intervention? A. Administer a stool softener as prescribed. B. Increase fluid intake. C. Encourage ambulation. D. Assess for abdominal distension. Answer: A. Administer a stool softener as prescribed. Rationale: the most appropriate intervention for opioid-induced constipation is to administer a stool softener as prescribed. Increasing fluid intake, encouraging ambulation, and assessing for distension are helpful, but are secondary to managing the constipation. 93. A nurse is caring for a postoperative patient who is at risk for a pressure injury. Which of the following is the most important intervention? A. Reposition the patient every 2 hours. B. Monitor the patient's nutritional status. C. Assess the skin for early signs of breakdown. D. Keep the patient's bed dry and clean. Answer: A. Reposition the patient every 2 hours. Rationale: repositioning the patient every 2 hours is the most important intervention to prevent pressure injuries by relieving pressure on vulnerable areas. Monitoring nutrition, assessing the skin, and keeping the bed clean are also important, but repositioning is the priority. 94. A nurse is caring for a postoperative patient who has an epidural catheter in place. Which of the following is the priority nursing assessment? A. Blood pressure. B. Heart rate. C. Respiratory rate. D. Level of consciousness. Answer: C. Respiratory rate. Rationale: epidural anesthesia can cause respiratory depression, making it crucial to monitor the patient's respiratory rate closely. While blood pressure, heart rate, and level of consciousness are important, respiratory depression is the primary concern. 95. A nurse is caring for a postoperative patient with a wound that is red, swollen, and warm. The nurse suspects infection. What is the most appropriate initial action? A. Apply an antibiotic ointment to the wound. B. Notify the healthcare provider. C. Cultivate a sample from the wound. D. Perform wound care and apply a sterile dressing. Answer: B. Notify the healthcare provider. Rationale. The first step is to notify the healthcare provider, as the patient may need immediate intervention such as antibiotics or drainage. Wound care and culturing should be performed after notifying the provider, not as initial steps. 96. A nurse is caring for a patient who has undergone a laparotomy. The patient has a nasogastric tube, NGT, in place. The nurse notes that the NGT is draining large amounts of clear fluid. What is the most appropriate action? A. Notify the healthcare provider. B. Increase the flow fluids to replace the loss. C. Continue to monitor the drainage. D. Irrigate the NGT with normal saline. Answer. C. Continue to monitor the drainage. Rationale. Large amounts of clear fluid draining from the NGT are often normal after abdominal surgery due to gastric secretions. The nurse should continue to monitor the drainage for any changes in color or consistency. If changes occur, then notifying the healthcare provider may be necessary. 97. A postoperative patient is being discharged with a prescription for warfarin. Which of the following laboratory tests should the nurse instruct the patient to have regularly? A. Hemoglobin and hematocrit. B. Prothrombin time, PT, and international normalized ratio, INR. C. White blood cell count. D. Blood urea nitrogen, BUN, and creatinine. Answer. B. Prothrombin time, PT, and international normalized ratio, INR. Rationale. Warfarin is an anticoagulant, and its effects are monitored through prothrombin time, PT, and international normalized ratio, INR. Monitoring hemoglobin, white blood cell count, and BUN/creatinine are not specific to warfarin therapy. 98. A postoperative patient is experiencing chest pain and shortness of breath. Which of the following interventions should the nurse perform first? A. Administer oxygen. B. Obtain a 12-lead ECG. C. Notify the healthcare provider. D. Perform a focused physical assessment. Answer. A. Administer oxygen. Rationale. The first action in a patient experiencing chest pain and shortness of breath is to administer oxygen to ensure adequate oxygenation. Afterward, the nurse can obtain an ECG, notify the provider, and perform a physical assessment. 99. A nurse is caring for a postoperative patient who has a Foley catheter in place. The urine output is 30 milliliters per hour for the last 2 hours. What should the nurse do next? A. Increase flow fluids. B. Reassess the urine output in another hour. C. Notify the healthcare provider. D. Check the catheter for kinks. Answer. D. Check the catheter for kinks. Rationale. The first step is to assess the catheter for any kinks or obstructions that may be restricting urine flow. If the catheter is clear and the output remains low, then further actions such as notifying the provider or adjusting fluids may be necessary. 100. A postoperative patient is experiencing increased pain at the surgical site. The nurse checks the incision and finds it intact, with no signs of infection. What is the most appropriate action? A. Administer prescribed analgesics. B. Apply ice to the surgical site. C. Increase the frequency of pain assessments. D. Reassure the patient and provide comfort. Answer. A. Administer prescribed analgesics. Rationale. The most appropriate action is to administer prescribed analgesics to manage the patient's pain. While applying ice, increasing assessments, and reassuring the patient are helpful, pain relief should be prioritized. 101. A nurse is caring for a postoperative patient with a Jackson-Pratt drain. The nurse notes that the drain is not producing any output. What is the most appropriate initial action? A. Irrigate the drain. B. Assess the drain for kinks or obstructions. C. Notify the healthcare provider. D. Empty the drain. Answer. B. Assess the drain for kinks or obstructions. Rationale. The first action is to assess the drain for kinks or obstructions that may prevent drainage. If the drain is clear and there is still no output, then further interventions, such as notifying the provider, may be required. 102. A postoperative patient has developed a fever of 101 degrees Fahrenheit 38.3 degrees Celsius 48 hours after surgery. What is the most likely cause of the fever? A. Infection. B. Surgical trauma. C. Medication reaction. D. Deep vein thrombosis. Answer: B. Surgical trauma. Rationale: a mild fever within the first 48 hours post-surgery is often a normal response to surgical trauma. While infection, medication reactions, and deep vein thrombosis could also cause fever, they are less likely in the immediate postoperative period. 103. A nurse is caring for a patient who is receiving morphine for postoperative pain. The nurse notices the patient is becoming increasingly drowsy. What should the nurse do next? A. Increase the frequency of pain assessments. B. Administer naloxone Narcan. C. Reassess the patient's pain level. D. Monitor the patient's respiratory rate. Answer: D. Monitor the patient's respiratory rate. Rationale: increased drowsiness can indicate opioid-induced respiratory depression, so the nurse should first monitor the patient's respiratory rate. If respiratory depression occurs, naloxone may be administered as prescribed. 104. A nurse is caring for a postoperative patient with a wound infection. Which of the following should the nurse expect to observe? A. A dry, pale, and intact wound. B. A warm, red, and swollen wound with purulent drainage. C. A dark, dry wound with a foul odor. D. A small amount of clear, serous drainage. Answer: B. A warm, red, and swollen wound with purulent drainage. Rationale: a wound infection typically presents with warmth, redness, swelling, and purulent drainage. Dry, pale, and intact wounds are generally signs of healing, while a foul odor or clear drainage could suggest other conditions. 105. A postoperative patient is at risk for fluid imbalance. Which of the following assessments is most important for the nurse to perform? A. Daily weight. B. Intake and output. C. Vital signs. D. Bowel sounds. Answer: B. Intake and output. Rationale: monitoring intake and output is crucial in detecting fluid imbalances, especially after surgery. Daily weight and vital signs are also important, but intake and output should be prioritized to detect early signs of dehydration or fluid overload. 106. A nurse is caring for a patient who has undergone a laparoscopic cholecystectomy. The nurse observes that the patient is experiencing shoulder pain. What is the most likely cause of this pain? A. Gas used during surgery. B. Infection at the surgical site. C. Blood loss. D. Pulmonary embolism. Answer: A. Gas used during surgery. Rationale: shoulder pain after laparoscopic surgery is commonly caused by the gas used to inflate the abdomen during the procedure, which can irritate the diaphragm and refer pain to the shoulder. Infection, blood loss, and pulmonary embolism are less likely to present with this symptom. 107. A postoperative patient is being discharged with a prescription for anticoagulant therapy. Which of the following instructions should the nurse provide? A. You can stop taking the medication if you feel better. B. Avoid all contact sports while on this medication. C. Take the medication with food to avoid gastrointestinal upset. D. You may resume your regular diet without restrictions. Answer: B. Avoid all contact sports while on this medication. Rationale: anticoagulant therapy increases the risk of bleeding, so the patient should avoid contact sports to reduce the risk of injury. Stopping the medication, taking it with food, and resuming the regular diet are not appropriate for this patient. 108. A nurse is caring for a postoperative patient with a nasogastric (NG) tube in place. The patient begins to experience nausea and vomiting. What is the first nursing intervention? A. Flush the NG tube with normal saline. B. Administer an antiemetic as prescribed. C. Reposition the patient to the side. D. Assess the NG tube for patency. Answer: D. Assess the NG tube for patency. Rationale: the first action should be to assess the NG tube for any kinks or blockages, as this could cause nausea and vomiting. If the tube is patent, administering antiemetics and repositioning the patient can help manage the symptoms. 109. A nurse is caring for a postoperative patient who has developed a hematoma at the surgical site. What is the nurse's first priority? A. Apply ice to the site. B. Assess for signs of shock. C. Notify the healthcare provider. D. Reassure the patient. Answer: B. Assess for signs of shock. Rationale: A hematoma can lead to significant blood loss and shock. The nurse's priority is to assess for signs of shock, such as tachycardia, hypotension, or pallor, before applying ice, notifying the provider, or reassuring the patient. 110. A nurse is caring for a postoperative patient who is having difficulty breathing. Which of the following is the nurse's priority intervention? A. Administer oxygen. B. Encourage coughing and deep breathing. C. Elevate the head of the bed. D. Assess lung sounds. Answer: A. Administer oxygen. Rationale: the priority intervention for difficulty breathing is to administer oxygen to ensure adequate oxygenation. After oxygen is administered, the nurse can perform further assessments and interventions, such as elevating the head of the bed or encouraging deep breathing. 111. A nurse is preparing a patient for surgery. The patient has a latex allergy. What should the nurse do first? A. Administer an antihistamine as prescribed. B. Notify the surgical team and anesthesia provider. C. Provide the patient with a latex-free environment. D. Document the latex allergy in the patient's medical record. Answer: B. Notify the surgical team and anesthesia provider. Rationale: the most important first step is to notify the surgical team and anesthesia provider about the latex allergy to ensure that latex-free equipment and supplies are used during the procedure. Providing a latex-free environment and documentation should follow after notifying the team. 112. A nurse is caring for a postoperative patient who has an abdominal incision. The patient is experiencing nausea and vomiting. Which of the following interventions is most appropriate? A. Administer an antiemetic as prescribed. B. Withhold all oral intake. C. Encourage deep breathing and relaxation. D. Assess the incision for signs of infection. Answer: A. Administer an antiemetic as prescribed. Rationale: the priority intervention for nausea and vomiting is to administer an antiemetic to alleviate symptoms. Withholding oral intake, encouraging deep breathing, and inspecting the incision are also important but secondary to managing the nausea. 113. A nurse is caring for a postoperative patient who has a Foley catheter in place. The nurse notes that the patient has not urinated for the past 6 hours. What should the nurse do first? A. Reassess the urine output in another hour. B. Irrigate the Foley catheter. C. Check for kinks in the catheter tubing. D. Notify the healthcare provider. Answer: C. Check for kinks in the catheter tubing. Rationale: the first step is to check the catheter tubing for any kinks or obstructions that may prevent urine flow. If the tubing is clear, then further action, such as irrigating the catheter or notifying the provider, may be necessary. 114. A postoperative patient is experiencing increased pain at the surgical site. The nurse finds that the surgical site is intact with no signs of infection. What should the nurse do next? A. Increase the dose of pain medication. B. Reposition the patient and offer comfort measures. C. Notify the healthcare provider. D. Administer a non-steroidal anti-inflammatory drug NSAID. Answer: B. Reposition the patient and offer comfort measures. Rationale: repositioning the patient and offering comfort measures, such as ice or relaxation techniques, may help alleviate pain. Increasing the dose of pain medication should be done after exploring non-pharmacologic interventions. 115. A nurse is caring for a postoperative patient who is at risk for deep vein thrombosis, DVT. Which of the following interventions should the nurse prioritize? A. Encourage the patient to perform leg exercises. B. Apply sequential compression devices, SCDs. C. Administer anticoagulant therapy as prescribed. D. Monitor the patient's vital signs. Answer: B. Apply sequential compression devices, SCDs. Rationale: the priority intervention to prevent deep vein thrombosis is to apply sequential compression devices, SCDs, which improve circulation and reduce the risk of clot formation. Encouraging leg exercises and administering anticoagulants are also important but secondary to SCD use. 116. A postoperative patient has developed a fever of 100.4 degrees Fahrenheit 38 degrees Celsius. The nurse suspects an infection. Which of the following actions should the nurse take first? A. Administer antipyretics as prescribed. B. Perform a wound assessment. C. Notify the healthcare provider. D. Increase the patient's fluid intake. Answer: B. To perform a wound assessment. Rationale: the first action is to assess the wound for signs of infection, as postoperative fever is often related to wound infection. Administering antipyretics, notifying the provider, and increasing fluid intake are important, but should be secondary to assessing the wound. 117. A nurse is caring for a postoperative patient who has developed a respiratory infection. The nurse anticipates that which of the following interventions will be prescribed? A. Antihistamines. B. Bronchodilators. C. Antibiotics. D. Antivirals. Answer: C. Antibiotics. Rationale: a respiratory infection is typically treated with antibiotics, especially if it is bacterial. Antihistamines, bronchodilators, and antivirals are not typically indicated unless specific conditions warrant them. 118. A nurse is assessing a postoperative patient's pain. Which of the following pain assessment tools is the most appropriate for an adult patient who is alert and oriented? A. Visual Analog Scale, VS. B. Numeric Rating Scale, NRS. C. Faces Pain Scale. D. FLAC Scale. Answer: B. Numeric Rating Scale, NRS. Rationale: the Numeric Rating Scale, NRS, is commonly used for adults who are alert and oriented. It allows the patient to rate pain on a scale from 0 to 10. The Visual Analog Scale, VS, and Faces Pain Scale are more appropriate for children or patients with cognitive impairments, while the FLAC scale is used for nonverbal patients. 119. A nurse is caring for a patient who has undergone a cholecystectomy. The patient is experiencing nausea and has no bowel sounds. What is the nurse's priority action? A. Administer antiemetics as prescribed. B. Reassess the patient in 6 hours. C. Reposition the patient. D. Notify the healthcare provider. Answer: A. Administer antiemetics as prescribed. Rationale: the first step in managing nausea after surgery is administering antiemetics. The absence of bowel sounds may be expected postoperatively, but should be monitored closely. If nausea persists, further interventions can be considered. 120. A postoperative patient has been prescribed a stool softener to prevent constipation. Which of the following interventions is most important for the nurse to implement? A. Monitor the patient for signs of diarrhea. B. Encourage the patient to increase dietary fiber intake. C. Assess the patient's bowel sounds. D. Administer a laxative as prescribed. Answer: B. Encourage the patient to increase dietary fiber intake. Rationale: increasing dietary fiber helps prevent constipation and works synergistically with stool softeners. Monitoring for diarrhea and assessing bowel sounds are also important, but the priority is ensuring the patient is consuming enough fiber to aid in bowel movement.